This episode of the Pain Education Corner is sponsored by the Comella Foundation. The Comella Foundation is committed to relieving pain naturally using osteopathic healing principles. Here at the Comella Foundation, we envision a world where people achieve their maximum potential by being empowered with knowledge and skills to heal themselves and others. This information is to be used for educational purposes only and not to be construed as medical advice. If you have any questions or concerns, please consult a licensed healthcare professional. Hey, Drew, and welcome to the Pain Education Podcast brought to you by the Comella Foundation. Today we have a special guest. Her name is Kaiten Rivers, and she is quite an expert in an area of study that I am not very familiar with. So what we're going to do is we're going to draw out her expertise. So Kaiten, welcome to the show today.
Thank you. Happy to be on board of getting rid of people's pain, fixing
Yeah. Awesome. Now we're going to talk about the advanced biostructural correction approach to pain relief. Now, I may have gotten that not quite right, and that's okay. That's why you're here today. You're going to be able to share more about that. I'd like you to kind of give everyone maybe a 30,000 foot view of what got you here today. You sound like you have quite extensive training. So could you share your resume?
Well, for many years, I guess I still am a licensed naturopathic physician. I have a Washington State license. I'm a Bastyr graduate. In Washington State, the practice law is pretty good in that you are like a primary care physician. You can order lab tests and make diagnoses, and you have a limited prescriptive authority, and insurance companies have to pay for you. So it had gotten to the point in my career that I was pretty good at fixing moods or balancing hormones or digestive issues. And I was referring out for the pain. And it was always a little bit trying to match up that pain with that practitioner, and maybe it was going to work out. And I've got a body too. And throughout my whole career, I have been, pick this up, play around with it, see what it'll do, what it won't do, put aside a lot of it, and put some in the back pocket for an occasional use. And what I want most is what's going to work with most people most of the time. Right? So what got me more interested in this ABC thing is one day I was getting up, and this is probably about 20 years ago. One day I'm getting up off of the floor, and I noticed I made old man sounds. And I was
old man sounds. Ooh.
Oh, yes, like, oh no, this has got to stop. And so a little while later, something comes in the mail, advanced biostructural. Oh, this is the best thing. That's sliced bread. But I'm pretty jaded at this point in time, and it's like, well, I'm not going to go do this training until I know what it is, what it feels like. And so I emailed the guy who put it together, Jesse Jackwitz. He emailed me a whole bunch of names that were in my area. I called up the offices, and whoever answered the phone didn't know what I was talking about. I got to the doctor, and basically they all kind of said some version of, we don't use that technique, and this guy is too full of himself. I thought, well, chiropractors saying someone's too full of himself. But there was this one lady who was about 10 miles away, and she was fine. So I figured, okay, I'm going to give it 10 sessions. That's a fair trial, right? And so I went to her, and for me, it took like the session 4, I went, oh, I think there's something different about this, because I had pressure washed a house about a dozen years before. And so this shoulder had always had some degree of ache to it. Sometimes better, sometimes worse, but it was just kind of always there. And on the 4th treatment, that started changing and going away. Okay. So I started to send all my clients to her. But then she decided to move about 40 miles away. And although I might try that, I wasn't going to get my clients to do that. But she's like, well, why don't you learn this? And I'm like, okay. And I eased myself into this, and it has been the most satisfying thing that I know how to do, both as a patient and as a practitioner. Because I've found it will get people out of pain, even if 10 other therapies haven't really been able to touch it.
This sounds great, and I want to get into the advanced biostructural correction here in just a moment. But right before we started, you had mentioned something about studying Baxter University. It sounds like you have more extensive training that you might share with our listeners.
Well, you want to know about the naturopathic training, or?
Yeah, I mean, it sounds like it's more than just advanced biostructural correction that you have expertise in. And I understand Washington State, you're currently presiding in the Asheville, North Carolina, Western North Carolina area, which doesn't recognize a naturopathic physician in the same way that Washington State does.
Yeah.
Is that okay?
I think there's about 18 states that really have a practice law to them. And
okay. So you're now in Western North Carolina. So that is that narrowing your scope in terms of how you can help people, or tell me more about that.
Well, I don't think it's narrowing my scope, or I guess this is a specialty skill. This is something not too many people know about, so that I can bring this to the Asheville area, right? And truth be told, I'm kind of missing some of the problem solving thinking stuff that the naturopathic stuff had to it. But I thought I'm going to offer this first and build things around it.
Okay. Sure. So,
you can ask me questions about other things, but this is it's not known very well, and I'd like to get it out there. I'd like more bodies getting fixed with this.
Sure. Okay. And this is can we call it ABC?
Yes, okay. That is what we call it, ABC.
Okay. We'll call it ABC, Advanced Biostructural Correction. That's what you would like to dig into even more today. Yeah. So we can draw that, your expertise, 18 years. Do I understand that correctly?
You've been 18 years as a practitioner of the ABC.
Yes, that is formidable. That is a long period of time for anybody to be focusing on anything. So that's fantastic. And that is, you are just a practitioner? Are you an instructor? How are you in the context of the organization?
Well, I'm at the master level in terms of the practitioners. I have been invited to join the teacher training that was just started on, one of the official things started on Sunday. So I have shown up at 2 different workshops and it helped people trying to get their technique down and stuff like that. So soon to be an ABC teacher and stuff. Nice.
Okay, that's good to know. Can you tell us more about what exactly it is? Advanced biostructural correction. The image that I got, and we'll make sure this is in the show notes in there. It looks like a person was kind of slumping over, and then there was a progression of them standing straighter and straighter and straighter. So I'm getting a picture in my mind of the direction that you're going with the work. But can you walk someone, like, what does a session look like? Let's just start with what a session would look like.
Let's start with the explanation I often will give a client if they're not familiar with this. So,
okay.
ABC, it was put together by Jesse Jetkowitz, who had an engineering background, went to chiropractic college, got out in the real world and said, how come this doesn't work as good as they told me it was going to in college? So he happens to be one of those intense, in-your-face type personalities. So he went out on his journey, his odyssey, to figure out how to predictably and consistently fix bodies.
Okay.
So there are at least four things that make this really special and effective. Okay. One, It's a head to toe treatment. It's
Okay.
a hands-on, it's a head to toe treatment, right?
Okay.
Because everything's connected to everything else.
Yes.
Right? Okay. Two, and it fits in really well with a lot of the naturopathic philosophies, is that I'm only trying to find the things that your body can't fix and fix that. Okay. So largely we're talking from your C7 down to your L5.
Okay.
All those vertebrae. Okay. When one of those slips forward, we don't have muscles to pull it back in place. Okay?
Right. Yes.
Right. Yeah. So that vertebra is not going to probably not slip straight forward, but it'll slip forward and to the side or something like that. But that creates an instability, and your body doesn't like to deal with instabilities.
And kind of thinking through from a chiropractic perspective, most of the adjustments they're making are from back to front. So I could see where Jesse, Jakowitz,
JT, yeah.
Would be like, hey, wait a minute. Things aren't going from front to back. So makes total sense.
Yes, when you explain to people, that's what, oh yeah, that makes sense. That makes sense. So you got a vertebra slip forward, that's an instability. Somewhere your body's going to recruit other things to twist and turn and to stabilize that.
Sure, yes.
And that's going to happen over and over again. And that's going to happen over and over again. And when you lose that capacity to compensate, I think you start getting more. So in ABC, so that is where you get those chronically tight muscles come from, right?
Yes.
That's the holding on for dear life, right?
Right.
We can undo the old, that we call what we call, this is old, but this is just nobody's stacked your bones up there.
Sure.
So in ABC, I look at you more like you're this tangled ball of yarn that we're untangling with each session, not that you're a crooked line that we're trying to straighten out.
Sure. Okay.
There's something that's known out there in the medical world. It's not really well known, but you can get tension in the meningeal system. Do you know what the meninges are?
Remind me, just in case.
Have you heard of meningitis?
Yes.
Okay, the meninges are the tissues that get inflamed with meningitis. So it's a sheath of tissue that attaches to the back of your face bone, wraps around your brain, goes down your spinal column, attaches to your tailbone. Each of your nerves has a little sleeve of that, but they can get kind of warped and twisted and scarred and adhesed. Right? They can keep your bones from staying where we want them, but they can also start pulling, putting tension on the nerves, causing all kinds of problems, not nerve damage, but you're just going to get a lot of pain and dysfunction. Right?
Sure.
So there's a way of taking the tension out of the meningeal system. And there's this thing that I do at the back of your head that reads where your mechanical stress is that day that your body can't fix. I work on that, right? And then the other thing I like about this is sort of like, it's a partnership with the body. It's like you show up in a certain configuration, I do my moves, and then your body is going to move the bones around that it can, now that I fix the things that it can't, right? We call that the unwinding. The next time you show up, you're going to be in a different configuration. And so it just goes back and forth as we unwind. To get you to that. Yeah, does that make sense?
Yes, yes, absolutely.
Yeah.
The body, from my understanding, my perspective, the body has an injury and it compensates, and an injury and it compensates. And what I hear you saying is we're beginning to reverse that process, the unwinding process of letting go of those layers of tension, the knotted ball of yarn you were referring to, that the body is able to reorganize itself.
Well, yeah. There's another concept that the body isn't totally self-healing, right?
Okay.
And the biggest sense is if you get your arm chopped off, you're not going to go grow another one, right? It can do a lot of things.
Yes.
It's amazing in what it can do. Yeah. But pulling that vertebra back on its own is not something that you can do. Now, if
Cor-
you can pull a, a segment, 3 or 4, you can kind of, because we can do this, right? But that individual
Sure.
vertebrae, pulling that back, you need some external help.
Sure. Okay. I could really agree with you there.
Good. Yeah. And then we have our we call it our sitting, sleeping, and standing recommendations. There again, this is another, in my naturopathic career in this, I'm telling people things that are kind of against what they've been told all their life. Right?
Sure.
So, but I can deliver the goods, right? If I can fix your body, I think you're more willing to say, but everyone else has told me I need arch supports. Why are you telling me not to wear arch
Right.
supports, So yeah, then the sitting, sleeping, standing recommendations are, so you're going to minimize the anteriors you give yourself throughout the day, so you can make more progress quicker. So to me, it's about giving people the body back a body that they can do whatever they want with, right? And I call it anti-aging adjusting. Because you will be able to do those things that you could do 20, 30 years ago.
Mm-hmm.
You're like, oh no, I'm just too old to that. The other thing is, it also acts like preventative medicine, in that if you get unwound enough, like if you're all tight, you fall, you break. But if you get unwound, you're going to have some resiliency, and then you can go and get in an accident or overwork, and you're going to expect to be this sore, only this sore, which is also pretty cool.
Sure. So are these sitting, sleeping, and standing recommendations, are they a way of getting the vertebrae that has shifted forward to shift back? Or
No.
is
No,
okay? I need more explanation around that.
It's a way of preventing a vertebrae, or minimizing the times that a vertebra will go forward.
Okay.
Yeah.
Got it. Now I'm really curious as to how these vertebrae that are shifted forward are helped to be shifted back. How does that work? How does that look?
So it will, we call them treatments, and it is going to look, a lot of this will look like other things that you've seen. But basically, if we're working on the upper vertebrae, the person is going to be against the wall. My hands goes behind for leverage, where it depends on which vertebra that I want to move. Then I'm in front, and I'm rolling the torso over my hand to create the leverage to move that bone back.
Okay.
On the lower ones, we will do on the table, kind of the same thing. My hand goes behind, I roll their torso down, it gets the lumbar moved.
And would it be considered like a direct or indirect type of approach that it gets the vertebrae to move back into place?
I would call it direct. I'm not sure exactly what you mean, but I would more direct.
Okay. From my knowledge and understanding of the body, a direct is going to be taking a vertebrae that's out of place and pushing it back into place. That would be direct. And indirect is going to be taking a vertebrae that's out of place, you move it out of place just a little bit more, which engages the body's self-corrective reflexes, and the body will pull the vertebrae back in on its own.
Direct, because if you're not moving the vertebrae, okay. So in this system, the one that is moved forward, that's coming up for today, and that twisted ball of yarn.
Sure.
We call out the primary biomechanical breakdown. That's the one that we want to move because the body can't. Anything else that's twisted up in there is a compensation. But by our definition, if you take away the primary biomechanical breakdown, the body has the muscles it needs to move things around. So you get to resolution of things. Now, the things that you're describing, we would call compensations. And if you take away the compensations. And oftentimes the area of compensation is where you're feeling the pain, right? So
Okay.
that's why someone wants to adjust that area, because that's where it hurts. But that's not the cause of the pain. The cause is that vertebra that you can't pull backwards. You would if you could, but you can't, right?
Right.
So that's, I think that's why, the adjustments that don't hold, it's because you're adjusting a compensation, and that's your body's kind of best way of dealing with something that it can't fix, right?
Right.
So like, well, let's take that away. It's like, no, I need that. Let's take that away, So sometimes you get lucky, and sometimes, the other thing that the terms that Jesse uses with this is predictable and consistent results. Right? And then, the other thing is, if I'm doing the same treatment on you, the protocol is the same. I'm checking for this, I'm checking for that. But if I always do C7 and L4, that's the pattern, we're not getting anywhere.
Right.
I had clients that I would be treated, and they'd be feeling this ABC is different, and they'd see things like, I went to the chiropractor once a week for a year, and he always did the same adjustment.
Right.
And part of me wants to go, what stories did you tell that he would get you to do that? It's like, but yeah, in the unwinding process, things shift and change, and it's not always fun and comfortable, especially when you're unwinding through your old injuries.
Yes.
That can be like, it's like, okay, it's good that it's back. It's kind of homeopathic that way, but we don't want it to stick around for long, just a quick visit. And if we're on the right track, and that's an unwinding, chances are other things, if you pay attention to your whole body, you're going to notice other things that are, I jokingly call them the side effects of the ABC. It's like, oh, this is really kicking up, but I haven't been able to turn my head like this, and I don't know when. Or
right.
Can take this deep breath, or some other things is going on that if you weren't paying attention to it, because when your body's working well, you don't pay attention to it, right?
Sure.
So I said, well, yeah, pay attention. If you only pay attention to things that are bothering you, you might be pretty annoyed with ABC. But if you pay attention to your whole body, you're going to probably see some nice little side effects.
Yeah, and I think that's a great point, because when people are going through the process of their body healing, the nervous system has this tricky way of just looking for the pain, but not looking for what just got resolved. Like you were suggesting, that the neck no longer hurts. Now I have this cramping in my upper back, or this pain in my hips or lower back, but my neck is free. And they're focusing on the fact that the cramping in the back or the pain in the hips and lower back are there, and they're not looking at the fact that the neck's no longer restricted. So
yeah, and I get treated too. So something starts bothering me, I get kind of like, why is that? So I understand what being on both sides of
sure.
Yeah. So.
Thanks for tuning in to today's episode of the Pain Education Corner. If you have a special talent or skill to relieve pain and you'd like to become a guest on our show, visit us at thecomellafoundation.org/interview. Help us spread the word on eliminating pain and suffering in the world. That's thecomellafoundation.org/interview. So a person comes to you with a specific pain. Are you looking or addressing that specific pain, or are you looking more like globally first, or how exactly does that work?
So, I'm talking musculoskeletal pain, right? This ABC technique is not going to fix a fracture or an infection or a tumor or something like that. We're just
certainly. So just anybody that's watching, make sure you go to your doctor, get an X-ray, a CT scan, an MRI, get a diagnosis, so we know what we're dealing with. And now
we know we're not going to cause any harm, and now we know we're going to be able to help and fix and that kind of stuff.
Right. So A lot of people, because I work with people with knee pain, they use the knees as an example. So I come to you hobbling in. I've gone for an X-ray, a CT scan, or MRI. Doctor says nothing is broken or torn in your knee, Bill. I have knee pain. I'm hobbling in to see you. How does that look? How would that go?
So I do want to know things like, are the bones the shape they ought to be? Because if they're not, that's a little bit of a limitation, right? I do want to know if there's any surgical interventions, and people usually want to tell the story, right?
Yes, they do.
But
Now, is that going to be helpful? Someone brings their X-rays or what they've gotten from the doctor to you, so you could look at the shape of the bones, or is that, kind of maybe?
it's real. Okay, it's really not necessary. If the bones aren't the shape that they ought to be, or even some surgical interventions, I call them like they're a bit of a wild card.
Okay.
I do not know if it's going to be a problem. I don't know if it's going to hamper what we can get done. Like when early in my career, I had a woman, she came in and she happened to have several of her neck vertebra, there's a metal plate fusing them together, right?
Yes.
So when she comes in, everything hurts, everything hurts, everything hurts. And we work, and gosh, her neck is what's really bothering her. And she did bring me some x-rays, and I'm not allowed to interpret x-rays. So I took them to Jessie. And, basically, if they had stacked those bones in the best anatomical position for her, we probably would have gotten her out of pain. Okay. Jessie looks at the x-rays and kind of puts them away and says, tell her they did her a disservice in how they have bones stacked. Okay. So it's, hey, we got most of her body out of pain, and so it's not necessary. And one of the things that I want to tell you that it can do is like all those, what I'm going to call the functional neurological things, the stuff that has a label, but they don't really have the clear pathology for it, like the cervical dystonia, the RSD, the fibromyalgia, lots of headaches, and sometimes you say, that's too much. There's nothing that can work on all of those things. But I'm going to tell you, it's the same. We determine what your breakdown side is. We see which meningeal release we need to do. We see what vertebra is forward that day that I need to fix. We run the protocol. You do the sitting, sleeping, and standing, and your body will do the unwinding, and you come back, and we just get it done. If your bones aren't, so if you want, things to return to factory settings, if you will, the ultimate stacking, that is a very long-term process. Okay?
Sure.
Years for just about everyone. Okay.
Sure.
And more if you've had a lot of body work, more for the accidents that you've had, right? And this is what I noticed, and then I talked to other practitioners in different parts of the world, because practitioners in lots of different parts of the world. So what I know from working on bodies, what I observed is 10 visits or less is going to be plenty of time for you to decide if you like the changes going on in your body. A lot of people can tell right away. I wasn't one of them. Okay. 30 visits or less, and that thing that you came in for, well, that's usually gone, and we've stabilized the changes enough that you can go out with really long-term relief. Okay? And so when I'm working with people with those things, I know their bone isn't quite they need to. So the treatment isn't necessarily different. I might find a bone on them that every time I do it, it makes things worse. And then I'm going to sooner or later figure out, okay, we just leave that one alone. That's going to be a false positive, right? Most of the people the management's a little bit different, okay? Okay, you've got a collapsed vertebra or something. You come in and you, after a number of treatments, you're like, I feel great. I haven't had any pain since that last treatment. And I'm going to go, okay, here's our options. You go away, come back to me when things hurt, or we can keep going. So when you have that abnormal bone or something, the management's a little different. Most people want to say, no, I want to keep going. I want to see what else we can get done.
And the 10 visits, 30 visits, is this once a week, multiple times per week? What are the spacing between
Twice
them?
a week. Twice a week is the best rate of change. More doesn't necessarily get you faster. If you're in a crisis period time, then you want to come in a little bit more. That's fine. But because it's that I move something and your body has to move things around.
Sure.
It works better if there is at least a day in between. Like you come in on Monday and I treat you on Tuesday. Tuesday, I usually don't find that as much to do as if I had treated you on Wednesday.
Right.
Yeah, so twice a week is the best rate of change. People still improve if they do less, but twice a week, it's, that's how fast it goes, and once a week is not half as fast, it's a lot less as fast because we start putting in compensations again.
Sure.
But people still get better. You're still moving in this curative direction, if you will. So I say I understand I'm prescribing for budgets and personalities and lifestyles.
Sure.
I'll tell them how I can get their body best the fastest.
Sure.
First time I set aside like 45 minutes because I have to do the explaining and all that kind of stuff. But 10-15 minutes on the follow-up point. There are some super speedy practitioners who can get it done and that, but I have fun. I like taking my time, enjoying the process.
Nice. And is there, I want to say, a profile of a client that would work best with this type of work? Or maybe I would say, ask you, well, maybe you could speak to the profile of a client that you've seen that it works best with. You could also see, you could also share a profile of your ideal client.
The ideal client is one who's willing to give this a try, sit back and, wait and, feel and understand. Because like I said, if I'm doing things differently. And if they're like really bent on, oh no, I just want activator, I just want activators. An activator's not going to move that vertebra backwards, right? So
Okay.
they really have these expectations, or there's using the right amount of force in the right direction when you need it, right?
Yes.
So and there's times when I need to do something gentle, and there's times when I need to give it a little force, right? So
Right.
if you can't handle that, I'm going to be using some force. So if your mindset is on different things, but people who are willing to give it a shot, and like I say, I can undo the old if they want. Part of it is because I can do this technique does do so many things because it's all the same what a body needs. A lot of people are disappointed because they have tried a lot of things and it hasn't worked, right? So hope
Sure.
gets expensive at a time at certain times, So someone who's going to be curious and let's see what goes on. Some person who's going to, I wasn't this person up front, but someone who's going to like work on the sitting and the sleeping and the standing.
I'm making a few notes here of an ideal based on what you're saying. I'm writing down a few things. The person needs to be open. They're going to want change in their body. They're curious, and they would be willing to do the homework. Willing to do the homework that you would ask them to do. Are there other elements or components of a client that would be an ideal fit for you?
Yeah, I have seen this change, benefit, resolve so many different things that there's not too much I wouldn't take on for, for a person I wouldn't mind spending time with, right? Sure. A person I wouldn't mind spending time with. Me, I've got some curiosities to see, because I haven't had these people come into my door as much as I would like to see what I can do, because there again, I like to dabble and get my hands and get some experience on, like asthma, right? Because we're changing that shape of that torso, we should be able to get you better breathing capacity, right? So if you're here and we lose 30% of your capacity with the asthma, this kind of chest, and you lose 30%, you're probably still better off ahead, right?
Sure. Yeah.
I have this curiosity with the cerebral palsy. I would like to start with the people who don't have any obvious brain damage. They haven't figured out why. It's probably just some meningiotensions and stuff. Once upon a time, I had someone I was going to try working on, and I needed to get his wheelchair set up proper for the the sitting. And he came in, and I sat him on the cushion. And one of the things you can do is, we have these wedge cushions. You twist the wedge so it's a little bit higher on someone's breakdown side, because I have a little bit more of a support on that, right? And it was just changing the angle of the cushion brought down the spasticity, instantly visibly noted, right? So I'm wondering how much of the neurological things wouldn't get better with that. So those are things I haven't played with enough to see how much we could, but all kinds of weird neurological stuff, fibromyalgia. It's really, I think you could really talk people into, the people who've been to the neurologist, and the neurologist has said, well, it doesn't follow a nerve pattern distribution, so I don't think that's what's going on, right? But in my world, it's like, well, maybe you have tension all up one side, the meninges. That's why you have pain all on the right side, even if it doesn't make neurological sense to the neurologist.
Sure. Is there a specific type of pain that you have found exceptional success with, or that you really enjoy working with?
Musculoskeletal pain, or
musculoskeletal pain,
weird neurological things that don't have a rhyme or reason, and that aren't metabolic, or tumor, or the infection, or a genetic type thing.
So I hear you saying you have this curious nature about yourself, that you like figuring out the human puzzle, so to speak, that it's like the ones that almost everyone has kind of said, wow, I'm not really sure what to do for this. You would be game for like digging in and going, hey, let's try this.
Oh yeah. Okay. So yeah, for the whole body. And then also there's a couple moves we do, like for people with shoulders, have some shoulder stuff. A couple moves we do that usually you can get more range of motion out of the shoulders right away.
Like frozen shoulder kind of stuff.
Yeah, anything that just, it just feels stuck. Or I think people who like the athletes or the dancers or that type of stuff, who have collected these injuries over the years, I think the alignment would help them function better. So here's a new one on me. Well, first of all, a while ago I was working on a transcendental meditation teacher. Lived in Fairfield. They have all the holistic stuff there, right? And I'm about halfway through, and she's like, this feels different than chiropractic. This feels like a real alignment. And then I was just working on someone the other day, just a little taste for stroke adjustment. And she's like, oh, yeah, more energy. Oh, my crown chakra, my crown chakra. So it's like, okay, maybe we can move this beyond the physical.
Sure.
So that was kind of new to me. No one ever mentioned that before.
Yeah. So this was someone that was more sensitive and aware of these specific energy flows in their body, that they felt the alignments or the work that you did with them. They felt this energy flow in ways that they hadn't before the alignment or the work
with the
that you
meningeal
did.
releases and getting the C7 there, you want to see more brightness in the face, more aliveness, and that is something that I will see. People come in and they're kind of flat, and then at some point in time they come in and they just kind of lit up. And I've seen that often enough to know I think it's because of some of this work that I'm doing.
Sure. Yeah. Have you ever seen any of the Kirlian photography?
No. I mean, I've seen it, but
and that, I mean, this is anecdotal at best. However, you could take the picture of the bioenergetic field or the aura around the body, and they take a picture of it, and it pictures in different colors around the physical body, and you can do like before and after.
That would be fun.
Yeah.
That would be fun. The other thing I am told, and I haven't experimented with it, is that get the structure better, and then many of the acupuncture meridians are going to be fun too. But I've never had it before either. So
yeah, there's so many things that in order to make it a true study to do it, there's so many variables that go into it. It's almost it's incredibly challenging to zero in and say, okay, well, we'll do this study on this type of thing to help improve the body. Ultimately, the proof is in how the person feels after they experience the work.
Yeah, exactly.
So, well, this has been great. Do you have, we'll wrap this up here in a little bit. Did you have anything else that I didn't ask about or didn't talk about? There was a loose end out there that you'd like to address?
I have all these little signs on the wall over there.
Oh, okay.
On things.
Perfect.
So, an ABC treated body has a much easier pregnancy and birth.
Ooh, okay.
I just spent a year out in the Amish world, and so women that had children before, and the women had the next baby with the ABC treatment body. It's like, well, yeah. So
nice. That's incredibly helpful information. It would make total sense that a body that's structurally in alignment would be able to, especially a pregnant woman who is structurally aligned, be able to pass a baby much easier as a result of that alignment.
Yeah. I don't know if everyone will get this, but this one woman said it was like the contractions were half as painful, but twice as effective.
Yeah.
Yeah.
Nice.
Yeah.
Cool. Any other sticky note over there off camera that you'd like to bring into the conversation here?
Yes.
What you got?
So, different websites and advertisements and stuff like that, they'll put these bright, sparkly people on there, and then you got the little asterisks down there, and they say these results are not typical. But if you go to the ABC Miracles or the meningeal release, the pictures that you see there, that's typical. That is what I would try. That's the kind of changes that I would expect this ABC to do on bodies. Needs the right number of treatments to get you there, but the picture changes that you see, those are typical results.
Great. And I'll make sure we have all of those links down in the description of that, as well as information as to how to contact you.
Yeah, and there's an ABC provider map in the ABC website. So there's people in Australia and China and the UK and Canada and throughout the United States. I think one person in India, and I think one person in South America. So kind of global, but
nice.
yet.
Cool. Well, we'll have all of that information as well as the practitioner finder, provider finder in
Better app, yeah.
that information will be in the description box below for that. Is anything else you'd like to say or share as we wrap it up today?
You know, I'm always happy to what I call provide a free 10-minute chat to people if
Sure.
they're going to come and be my clients, so I can answer the questions, see if we'd be a good fit working together. So
Perfect. What we're doing, and this is, I don't know if I've shared this about with you as well with the Comella Foundation, the nonprofit, is we've set up a pain relief portal, and that we have some people that are doing muscle testing, remote muscle testing. So they fill out the application on the Comella Foundation website that sends an email to one of our remote muscle testers, and then they test on which practitioner would be the best alignment or be able to help them the most based on when
so
they,
they're just not technique, they're the practitioner.
the practitioner. Yes. So
Okay.
anyone that I have interviewed, they'll get the muscle test to zero in on the page on the website and the specific practitioner. Then they get a link to the interview that I did, and then the ability to set up a consultation with that person to get help, support, direction, whatever that is from that practitioner.
Wow.
So
So
we will,
that way I will do my best for them.
yeah. So that would be in total alignment. We'll be in touch after this to get that all set up and lined up for you to be able to be that the correct contact information will get to you.
Okay, great. Thank you.
Perfect. Well, I thank you so much for being here. This was an interesting journey learning about advanced biostructural correction, also known as ABC. We refer to as ABC today. It was a pleasure having you here and talking with you. So thank you very much for taking the time with us today and sharing your knowledge and expertise with us. Awesome. So if there isn't anything else you would like to share,
I think I got it all.
then you got it all. Awesome. Well, okay. You did great today. I know there was a little bit of hesitation. You did awesome. You breathed, you shared your good stuff. So this is fantastic. And I will go ahead and wrap it up now. So this is Bill Paravano. Thank you. This is Bill Paravano, the knee pain guru, bringing you the Pain Education Podcast brought to you by the Comella Foundation. Thanking you so much for being here. Have a wonderful day, and we will see you on the next one.